All right, so we talk about communication. Communication, they say it's 50% of any relationship, right? So what about those who can't communicate or have difficulties communicating? What about a medical call? A medical call is 85% communication. So how are you going to be able to interact with somebody who may have challenges interacting with people? There's a few things that you need to know before you ever walk through the door. When, as soon as you find out that this is somebody with a developmental or an intellectual disability, there's some things that I want you to remember. Before we get started, it's important that you know we're not trying to teach you to be social workers. We're not trying to teach you to be nurses, doctors, any of that. This is in those instances where there's time to use the finesse. There's time to be kinder and gentler and help take care of the person's needs specifically. That's what we're talking about. If it's time to be a firefighter, you do whatever it is you need to do to take care of that situation. All right, so just understand me that I don't mean to use this type of information on an everyday for every occurrence, only when the call calls for it. All right, so some etiquette that you need to remember when we're talking about these, when we're dealing with people with developmental and intellectual disabilities, we use what they call person-first language. And what that means is Noah is a boy with autism. He's not an autistic boy. See how I did that? You put the person first, then the disability. Person first, then the accessory that they need, or they use this, or whatever it is. You list the person first, and the point behind that is autism is not all Noah is, right? We don't want autism to be the emphasis. We want the boy to be the emphasis, because just like everybody else, they're humans. They're human beings with souls and hearts and minds, and just like everyone else, and they should be treated as such. They deserve the same respect as anybody else that we're dealing with. So this is how we do that. We deliver person first. So think about you walk into a house and this person, the caregiver, meets you at the door and they're scared to death to call 911 because they don't know what training you've had. They don't know what you're looking for. You may find something in their house that doesn't look right and you call Child Protective Services, or you start questioning them about something that you don't understand. So that creates a scary environment for the people who live there, the caretakers. But you walk in the door and you're caring and you're using person-first language and you're not saying some of this other stuff. You can ease that person's mind, and like I said in the beginning, make that call go smoother from the get-go, as opposed to walking in there and using language that you shouldn't be using, saying things that shouldn't be said, and just making the call go haywire. Some things that we never say, Down's baby, mentally retarded. You cannot say retarded kind enough, soft enough, gentle enough, caring enough. There is nothing you can say to make retarded okay. Take that out of your vocabulary every day for the rest of your life. You can never say it and it'd be okay anywhere you are, no matter what. All right? So don't ever use it. Never, ever, ever. Just get that out there. Handicapped. Same stigma that goes along with retarded goes along with handicapped or brain damaged. We don't use those because of the stigma that goes along with them. Nobody wants to be associated with that. Confined to a wheelchair. That's Emily's big one. The wheelchair is her freedom. Without a wheelchair, what would she do? She wouldn't be able to do anything. So her wheelchair is how she's able to get out in the world and see the world. So she's not confined to her wheelchair. Her wheelchair is her freedom. And mine is normal. To say your child is normal is to say my child's not. And my child is very normal. He loves all the same things your child does. He's not typical. He's not typically developing. That's this right here. We use the term typical, typically developing, or typical developing student. All right, that's the difference between Noah and your children. He's not developing the same way they are. So he's not typically developing. So just keep those things in mind, if you come across some of this stuff, that can definitely help a call go smoother if you run into someone with developmental or intellectual disabilities. The next thing we want to talk about is the 10 Commandments. The 10 Commandments of disabilities. The first thing you want to do is speak directly to the person. All right? Nobody likes to be talked around. And you don't know what the cognitive abilities are of that person. You've been there for 20 whole seconds. Right? So we don't want to talk around anyone. When we want to talk directly to them. Just like I'm looking every person in this room in the eye and I'm moving around. That's how you want to do it whenever you're on a medical call or in the room with these people. And that person can be a hospice patient that's on the way, dying as we speak. It doesn't matter. They still deserve the same respect as everyone else. We want to look them directly in the eye and speak directly to that person. We want to look at others too, but we want to look directly at that person. Shake hands if that's appropriate. Now, it's not always applicable in our situation. It may not be at all. And if it's not, that's fine. But if it is, shake hands. Identify yourself. If you're responding in on a Chattanooga Fire Department apparatus and you're approaching as an EMT, you should be identifying yourself every single time. All right? Every single time you should be identifying yourself. Now, with this particular population, that's even more important because they like routines. They like things to be the same. And when you show up, you're not part of that routine. So you need to work your way in. Hey, how you doing? You know, my name's Skyler. I'm with the fire department. How can I help you today? What can I do for you today? You know, work your way in gently. Don't just walk in and go straight to work and start hammering them with questions, right? Identify yourself. Offer assistance, wait for acceptance, listen for instructions. When I see this, when I think about someone in a wheelchair. All right, so you see somebody who's stuck in a hole, their wheelchair is stuck in a hole. You walk up to them. Instead of just grabbing hold and moving them out of the way, like, you know, just invalidating that person completely, you're going to walk up to them and say, hey, how you doing? My name's Skyler. I'm with the fire department. I see you're having trouble. Can I help you? And they're going to say, absolutely, please. Or they're going to say, no, I'm fine. I got it. And if that's the case, then you turn around and walk away. Okay, have a good day. If they say, yes, please, then say, how can I help you? What can I do to make this better? How can I? And they're going to say, oh, just help me, you know, lift me up out of this hole and push me out of the hole. And you're going to say, sure, and it's going to be a piece of cake for you, and you're not going to have any problems, and you've made that person's day. But you've shown them the respect. You've validated who they are. You didn't just walk up to them and pretend that they're just something in your way, right? A wheelchair is an extension of their body. That's who they are. That's part of who they are. So to walk up and just grab the handle of somebody's wheelchair would be the same as walking up and grabbing somebody by the ear. You know, and that's totally invalidating for that person. So you don't want to do that. You never want to do that. You never want to touch anything without asking and making sure that that's okay first. Treat adults as adults. Again, you don't know the cognitive abilities of this person, right? You've known them for 20 seconds, the duration of that medical call. You cannot know the cognitive functions, cognitive features of someone with a disability. So until it's been proven otherwise, we treat all adults as adults. Respect wheelchairs and guide dogs. We talked about the wheelchair. It's viewed as an extension of their body. The guide dogs are the same way, and we're talking about the seeing eye dogs here, you know, the guide dogs. If you have to treat a person who has a guide dog, they're going to have two things. They're going to have a leash and they're going to have a harness, right? You've all seen that? We only handle the leash. We don't handle the harness. That dog, when somebody's got a hold of that harness, the dog knows he's working. He's doing his thing. When we grab the leash, he knows that you're leading him or her. So we always want to be sure to use the leash, not the harness. Listen attentively to those with speech impediment and ask them to repeat. All right, so, you know, people with speech impediments, they get made fun of a lot, right? It's very important that if you hear somebody that has a speech impediment that you focus on them. You don't want to be over here screwing around, messing around, doing whatever, and then they talk to you and you turn around and say, what'd you say? You know, they're going to think that you're just somebody else messing with them. We need to treat them with respect, that the same way as we treat everybody with respect. Be at eye level. That's very important. If any of you have ever had a pediatric class, we always teach be at eye level for the pediatric patients. But you know, it's also important for people with developmental and intellectual disabilities, as well as people in the PTSD community. You know, standing over someone is a sign of dominance. That's something that they teach you in the police academy, to stand over and show that you are the dominant force in this call, right? But when you're dealing with people who have special needs, you have to adapt to those special needs. And being at eye level may be just the thing that calms that person down. Standing over them, being dominant over top of them, somebody with PTSD, could be a trigger, you know, and send them into, you know, a PTSD episode, and then you got a fight on your hands. And that's the exact opposite of what we want. Like I said, we want the call to go smoothly. So be at eye level. Face a person with hearing impairment. That goes without saying. You know, we all struggle, or most of us struggle with that, or at least have somebody in our fire stations with, you know, hearing loss, riding on fire trucks for so many years. Relax. Don't be embarrassed by certain phrases. So Lisa tells Emily to run all the time. She has no use for lower extremities. Does that mean to physically get up out of your wheelchair? No, of course not. That means let's go, hurry, run, right? And these people know that you don't live in this world every day. So you don't necessarily know all the stuff that goes along with it. And if you say something that maybe they physically can't do, they're going to know what you mean. There's no sense in backing it up, making a big deal out of it, and embarrassing you and them both, right? So just keep going, go with it, and don't worry about it. And I hate it when people do this. They tell you 10 things and give you 11, but assume competence. we want to assume up, right? We don't want to assume down. Assuming down, you're invalidating these people. That's what you're doing. When you dumb it down, you assume down, you're invalidating it. You're saying that they're not, you're not giving them the respect that they deserve. And we want to give everybody the respect they deserve. We want to assume up until it's been proven otherwise. All right, so speaking to a person with disabilities, we talked about that, how that could be a challenge. So what are some ways that we can do that? How are some ways that we can find out? Maybe this is somebody who's just like Noah, that doesn't look any different than anybody else. How can we find out? Maybe we've checked a few things off our list, and we just want to ask them. So what I'm going to do is, hey, how you doing? My name's Skyler. I'm a paramedic with the fire department. Do you have any medical conditions or disabilities that I need to be aware of? Just slide it right in there, That's just, we all have a routine that we go through. We've all been doing this for years and years, and we've developed a routine for every medical call that we do exactly the same way. Just make it a part of your routine. Make it a part of your everyday, questions that you ask. If you don't ask that, maybe ask them if they live with somebody. So do you have a caregiver? Is there somebody that takes care of you? They're going to say, oh yeah, I live at the group home around the corner. Just be gentle. You don't have to just, be brutal. You can ask and work your way up, right? Use whatever they're saying or doing as insight into other ways to communicate. If you see my son, there's probably about a 90% chance that he is going to be playing with a toy helicopter, watching helicopter videos on his iPad, or playing helicopter videos on his iPad. He's going to be doing something that has to do with helicopters. So you can walk up to him. Maybe you've worked on it. Maybe you know something about helicopters. You could talk about that. Or you could say, man, that's cool. What is that? You like helicopters? Tell me, what about helicopters? What do you like about them? Get him talking. Get him moving. Once you start getting that momentum going, you get to talking to him, then you can start working your way, working other things in. Okay, so what's going on with you today? How are you doing today? So watch this gentleman here. He does a great job at doing what I told you.
Over the last 2 years, I've traveled the world and met nearly 1,000 people diagnosed with different conditions. This experience has taught me there is one universal rule that will allow you to form a meaningful connection with anybody, enabling that person to reach their full potential. Now, before I tell you what this rule is, I must first demonstrate it for you so you can see its effectiveness. I recently met a young man named Henry. Circle. Henry is on the autism spectrum, and during the interview, he was yelling out shapes. I decided to have a seat with him. Is it okay if I sit with Henry real quick and you go stand out there? Yeah. I have an idea.
Ball, rectangle, bus.
Hey Henry, will you sit right here with me? Square.
Present.
I recognized Henry's naming of shapes as an attempt to communicate, a desire to connect. So I sat with Henry and we formed a bond in a way which he felt comfortable. Rectangle.
Bus.
Circle.
Clock.
Triangle.
Pizza.
You're good. Every person in this world has a different level of communication. It doesn't matter if it's Henry, me, your great Aunt Marge, everyone has a little bit of a different frequency. But if we can adjust to these frequencies, you can form a meaningful connection with anybody.
Square looks like a present.
Let's open up the present. What's inside?
A puppy.
Is the puppy big or small?
Big.
Is it mean or nice?
Nice.
What does the puppy say?
Rough.
My friend Henry left the room. I switched over to my Ninja Turtle bow tie and Ansel came in. It's nice to meet you, Ansel.
Look at the flat effect that I was talking about.
Ansel survived a brain injury as a child. He is perceiving the world in a different way. So that is the camera. And people are watching us and seeing how great you are. Rather than forcing him into my mold, my expectation, I sat back, forgot about the camera, and wondered how I was going to connect with him. As adults, we're often stubborn. We want everyone to see us eye to eye, on our level, even though humans are all over the place. Through everyone I've met, I've learned if I remain flexible, I can form a bond with anyone.
Almost cracks a smile there.
secret to interpersonal connection and maximizing human potential is those who can adjust, inspire. You have to be willing to adapt to anyone's level of communication. And once you can look someone eye to eye on their level, they will want to learn and grow with you.
Ansel, you taught me that sometimes just being with someone is more than enough.
So he said, the key to interpersonal connection and maximizing human potential is those who can adjust, inspire. And that's the truth. You're going to have to adjust what you're used to. You're going to have to get on their level. You're going to have to enter their world because they're not coming into yours. And I think that's the biggest component, the biggest key when trying to interact with someone with special needs. So just keep that in mind. Y'all may remember this. This happened up in Bradley County. It went viral, went nationwide. The newspaper said Deputy Corey Loftus was dispatched to a residence in reference to a boy with autism who was severely agitated. The mother knew Bubba loved officers, so she called for the deputy to respond to her house. When Deputy Loftus showed up, he was able to calm Bubba down and showed him how to channel his frustrations by doing push-ups. The mother advised Bubba was laughing before Deputy Loftus left, which at the time I thought was impossible. Christy Richardson, who is Bubba's mother, stated, "I can't thank Officer Loftus enough for being so caring through it all." And this is exactly what we talked about. They're on the same level there. He's eye to eye with that man. You know, this isn't a small guy, right? So this could be a very explosive situation. But he's in here, he's stimulating that proprioceptive response with the push-ups. It couldn't be any more perfect. I mean, this is just a perfect example of how to communicate with someone with special needs. And parents are starving for this stuff. Parents of special needs, with special needs children, caregivers, are going to make this go viral every time, and that's why. Because they're just starving for this type of stuff. Here's another one. It says sometimes taking those extra little steps make the biggest difference in someone's life. You know, this gentleman right here, I think he's about 16 years old, was contemplating suicide. Officer Purdy right there, you can see that's probably not a technique they teach in the police academy, right? He couldn't be any more open than he is right there. But that's eye to eye. They're right there. He's showing that man every bit of the respect that he deserves. And because of that, they became best friends, and you know, he's taking care of them. That's community relationships right there. That's what you want. That's the outcome that you're looking for. So just keep that in mind. Those are the kind of things that we have to do to try to interact with someone. It may require some outside the box thinking, but it will pay off in the long run. All right, so we're communicating with people here. Some of these guys have literal meanings. Some of the things that we say have literal meanings. So we can't use words with dual meanings, metaphors, simile, idioms. You know, we can't do this at home. We struggle with this almost on a daily basis. You know, I'll say something and my wife will hit me and I'll have to reword it. Here it says, "Dad, will you put my hair in a bun?" If you haven't noticed, he chose a hoagie there to put her hair in. And that's the kind of things that these people think about. You know, the literal translation of things. They don't necessarily think about there being another way for that to transfer. So keep in mind when you're talking to someone with developmental or intellectual disabilities, they may not be able to comprehend what you're saying. You know, those small little jokes that are hilarious, completely over their head. So just keep that in mind. When you're processing requests or commands, you can't ask someone who is a concrete thinker. So those days when you were growing up, you know, and your parents said, your mom said, "Hey, how about cleaning your room?" Or maybe you use that on your kids. "Hey, how about taking out the garbage?" You know, to someone who is a literal thinker, there's two answers to that, right? No is a perfectly acceptable answer. So when you ask somebody who is a concrete thinker to do something that you want them to do, they may very well look at you and say no. So you have to use direct commands. You have to tell them exactly what you want to do. So keep that in mind. You can never assume that inferences are understood. Lisa tells a story about going to her father's house in Ohio, and when Emily was growing up. And when they were getting ready, she'd been playing with her stuff, and her grandfather says, "Hey, Emily, go pick up your toys." So Emily goes in, she wheels into the living room, she starts picking her toys up. And then she starts setting one down and picking another one up, setting one down, picking another one up. And her grandfather starts yelling at her, and her mom's saying, "But you didn't tell her what to do with them. You told her pick up her toys, but you didn't tell her to put them in the toy box." So that was the inference there. That was the problem. He skipped step C. He didn't say pick up your toys, and put them in the toy box. So she was completely confused. She was completely lost because she didn't put that together. She didn't understand the inference. So you can't skip steps when giving instructions. A, B, and C. Not all kids can transfer skills across environments. So just because the mother says, yeah, they do that at therapy all the time, doesn't mean they can do it out on the interstate after a car accident, or they can do it at the, out front when their house is on fire. So just keep that in mind. And remember that all behavior is communication. That goes for anybody. That goes for the people in this room. There are times when we communicate non-verbally, or there's times when we communicate in the way that we speak, the way that we talk, when our voice starts getting louder, or we start trying to get our point across. Behavior is communication for everyone. So just don't assume automatically that this is an issue of compliance, that they don't want to do what you're asking them to do. It could be that they don't understand you or whatever. So just remember that it doesn't necessarily mean compliance. All right, navigating the rules, it can be a challenge for a lot of these guys. This is a challenge for Noah all the time. If I tell him not to do something and then I turn around and do it because there's things that kids can't do that parents can, he's going to turn around and get on me because I said he couldn't do it. That was a rule. That was part of the rules. We told him we couldn't do that. So that poses a particularly challenging environment for first responders. Say you arrive on the scene of a single-story house fire and you see them standing there in the window, and you're like, jump out the window. Come on, right here. I'm right here. Come out the window. And they say, but Mom said I don't go out the window. I'm not supposed to go out the window. They turn around and go back into the house. So you can see where that could be a challenge. One of my mentors that I got some information about when I was learning about this or putting this stuff together talks about a story that happened up north where he's from. They had a man with Asperger's who was cooking dinner and set the cabinets on fire. And in the process of setting the cabinets on fire, he set his shirt on fire. So he runs out the front door, takes his shirt off, slams it on the ground, stomps it out, and then turns around and says, I'm not supposed to be outside without a shirt on. And back in he goes. House is on fire. First engine company arrives on the scene. The BC corner of the building is rolling. They can see the man in the window. At street level, they can see him going through the closet, going through his drawers. They get there, throw a ladder, whatever they do, climb up into the window, wrestle him out, put him on the ground, and like Tigger, he bounces right back up into the window, right back up the ladder and straight into the window. He goes in, grabs his shirt, puts his shirt on, walks himself down the ladder. And that's what you have to be careful of. To go back to what we were talking about the pain processing, they got him in the ambulance. This is a true story. They got him in the ambulance, and the paramedic said, were you frying chicken? The man says, no. They lifted his shirt, and he was burned all the way across there and never complained once. So that's another reason why assessment is so important when dealing with these people. So keep that in mind. If you're not sure, don't say it. If you said it and something has changed, convey that message clearly. Every morning when I drop Noah off at school, I'll drop him off after work and say, I'll come over here to teach this class. I have to tell him before he gets to school that we're not going to be the one to pick him up. So when we're leaving the house, I'll say, hey, buddy, don't forget, Papa's going to come pick you up from school today. And then we'll be driving. We'll go to Chick-fil-A. We'll be sitting in line at Chick-fil-A, and I'll say, hey, buddy, don't forget, Papa's going to pick you up from school today. And then we'll get in the car line, and we're sitting there waiting on his turn. And I'll say, hey, buddy, don't forget, Papa's going to be at school to pick you up this afternoon. And then whenever I get out of the car and I'm putting his backpack on his shoulders, I say, hey, buddy, who's going to pick you up at school today? He says, Papa is. So I know that he gets it. He understands. Because if I drop him off, it's understood that I'm going to be the one to pick him up, right? I mean, that just goes without saying. One would think. That's how he thinks, that concrete thinking. But we had to convey that. And I don't mean that we have to do that from time to time. I mean every single day. We have to convey that message to him. So you have to be particularly careful with time references. If you say something's going to be in 5 minutes, at 4:59:59, they may be looking at their watch saying, hey, you said 5 minutes. It may be much easier and still falls under that concreteness, that concrete category to say 5 to 20 minutes, 5 to 30 minutes, right? So that gives you some wiggle room to still do what you're talking about and everybody's happy. So just keep that in mind. If you say something, it better be right. And if it's not right, you better make sure that it's changed before it becomes unright. I know that's not technically correct, but. All right, so communication, when you're processing requests and commands, there's things that we can say or do that cause someone to shut down immediately. And there's different reasons for that. All right, so it could be that the request that you've asked them is too difficult. What you've asked them to do, they don't understand. They're not going to ask you questions, just like with Emily. You know, she was picking up the toys, she got her lap full, and she started putting them down. She didn't say, "Hey, Grandpa, what do you want me to do with these?" Right? She didn't. She just picked it up, set them down, and kept going, kept putting them in her lap. So it could be that what you've asked them is too difficult, and they just shut down. It could be that they're overloaded. Do you think I could get anything across to Noah when we were going through that on that video that I showed you? You're not going to get anything across to him. He's not listening. He doesn't care. So it could be that they're already too overloaded to understand or to listen to. I touched on this a minute ago. You're the new person to acclimate to. They like that concreteness. It has to be the same way every time. And they don't know you, right? They don't want to talk to you. So it could be that you are the source of the problem, just being there, just being that person. Expectations of questions not coming from a certain individual. So you ride up, you're on a fire truck, and you start asking them medical questions. What? That's crazy. People on fire trucks put out fires, right? They don't ask medical questions. So it could be that when you pull up, they think, all right, we're going to get to see some firefighting stuff. And you come down and you start asking them medical questions, and they just blank out. So just keep that in mind. They may answer yes to everything, or they think you want that answer, so they say yes to everything, or no to everything. So if you're getting the same answers over and over and over, change it up. Ask something that you know the answer is no to, or ask an open-ended question. Try to get some other kind of answer. Just like I told you about Noah when we first started, he answered yes to everything. He knows you're looking for an answer, and that's a perfectly good one, so that's what he gives you. So just keep that in mind. And then finally, allow processing time. I read a statistic that said it could take 7 to 10 seconds for someone with a developmental disability to process a single question. So it is so important that you don't come in there just rapid fire questioning one after the other, boom, 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 boom. Ask a question, get an answer. Ask another question, get an answer. All right, I heard a story about a state trooper who has Asperger's, and her coping mechanism is when somebody starts asking her questions, she visibly sees it going in her head on a reel-to-reel, like an old-timey reel-to-reel. And then when they stop, she pulls that out one at a time and answers the question back one at a time as she gets it. That's the coping mechanism that she has learned over the years. But a lot of these guys aren't going to have that kind of coping. So just keep in mind that you have to allow processing time for each question. All right, so processing emotion. This can be particularly troubling place for a lot of these guys. They struggle with controlling their own emotions. I told you all about Noah. He is very moody, cries a lot, whatever, back and forth, up and down. There's no rhyme or reason to it. He struggles with his emotions on a regular basis. They struggle with knowing how to respond to others' emotions. I've read about people who have said that looking at your face is like a blob. They don't see any smile. They don't see any frown. They don't see any tears. They don't see any of that. So they have trouble responding to what you're saying. A lot of communication is more than just talking. I'm using my hands, using my facial expressions. I'm getting my point across that way. And a lot of those cues are completely lost on these guys. They just don't see it. They don't get it. So keep that in mind. They may respond inappropriately. I've seen Noah, surprise him with something that should be good and happy and fun, and he starts crying. Or the exact opposite, some bad information, something sad, something bad happened. You would think somebody would cry, and they start laughing. So, that some of these emotions can be challenging for some of these people. So just keep that in mind. Some reasons behind some of the behavior that they may be exhibiting, some of the behavior that you're seeing, maybe they're having a meltdown or they're overloaded or, they're having trouble processing. There's a lot of things that we want you to consider before you just assume that they don't want to do what you ask them to do. Right? We don't want to just automatically assume that this person is being non-compliant. It could be that they're already, like we said, they're already overloaded, and they don't want to communicate anymore. They're done. They're processing the instructions. They're having trouble processing what you're saying. They're having trouble listening to what you're saying. So that could be a reason. It could be that they can't hear you. They can't hear the instructions that you've asked them to. Remember me telling you, some of this information could be coming in at all levels. So the information that you're trying to give them is being flooded out by the noise of the fire truck, the noise of people talking, the noise of a crowd, whatever. You know, it could be drowning all of that out. Is the task too difficult? You've asked them to do something that they can't physically do. Maybe they have communication challenges themselves. And then again, you know, with Noah, you know, he's a 6-year-old boy. He's still a 6-year-old boy, and he's going to do the same thing that 6-year-old boys do. So, you know, it could be that he's just trying to seek attention like other 6-year-old boys do. Is there a trust issue with the medical community? I told you about Emily with her shunts, and she would have to go in every so often to get a CT scan. She'd have to go into the hospital, get a CT scan, make sure everything's okay. And she didn't have any problems doing that, didn't mind doing that until the one day when she gets to the hospital and the hospital's booked up. They're slammed. They're trying to hurry her through. You know, instead of taking a few minutes and being kind, you know, this is the sweetest little girl you've ever met in your life. And they're trying to hurry it up. They're trying to, you know, move the process along, so they physically restrain her. They force her to do all this stuff. And from that day forward, she didn't want to have nothing to do with it. You know, that was a PTSD incident in her head that she associated with the hospital, and she didn't want to go. She didn't want to do anything, have anything to do with it. So imagine the situation that put Lisa in, having a child with 27 diagnoses, and now she doesn't want to go to the hospital. And still to this day, Lisa said that she doesn't want to go to that side of the hospital. You know, it's still a big sore spot for us. So assume any of these things before you just assume that it's non-compliance. There could be a lot of stuff going on that you don't know about.